So I'm a neuroscientist at McGill University studying the biology of Alzheimer's disease in living humans. Alzheimer's disease is a progressive neurodegenerative disease that results in gradual cognitive decline, involvement of other cognitive domains like thinking and language, and eventually results in dementia. The definitive diagnosis of Alzheimer's disease, up until very recently, required an autopsy evaluation of the brain to investigate the presence of two specific brain pathologies, amyloid-β plaques and tau neurofibrillary tangles. If these two brain pathologies were observed in the brain at a specific level of severity, a diagnosis of Alzheimer's disease could be made according to the autopsy criteria. But in living humans, the diagnosis of Alzheimer's disease is very, very difficult because many different diseases can result in those same symptoms and can result in dementia. So in living people, only the diagnosis of probable Alzheimer's disease could be made based on the signs and symptoms alone, because the correspondence between the symptoms that we typically associate with Alzheimer's disease and the pathology was kind of limited. So therefore, it's important to distinguish between two terms when studying Alzheimer's disease. Dementia, which is cognitive impairment that's severe enough to interfere with someone being able to perform their activities of daily living. That's one thing. And Alzheimer's disease, which is a specific disease process defined by the accumulation of amyloid-β plaques and tau neurofibrillary tangles, which results in dementia. There are many different kinds of disease that result in dementia, and dementia is more a description of the clinical syndrome, and different diseases describe the pathological and biological processes. So biomarkers are very important because they can help clinicians answer questions that they can't answer solely based on signs, symptoms, and medical history. Generally speaking, we associate Alzheimer's disease with clinical symptoms of progressive amnestic dementia, meaning dementia that's where the cognitive impairment is most severe in the memory domain, and progressive meaning it gradually gets worse. So we associate Alzheimer's disease with this progressive amnestic dementia that eventually involves other cognitive domains like language and executive function. But the tricky thing is that a number of different diseases can lead to these symptoms. So biomarkers can help clinicians understand who has Alzheimer's disease as the cause of their symptoms and who doesn't. This is very, very important for understanding whether a patient is going to respond to a specific medication, such as acetylcholinesterase inhibitors, which can help in Alzheimer's disease, but they can be harmful in other diseases that cause dementia. And it's also important, especially as new therapies for Alzheimer's disease are becoming approved and are becoming accessible, at least in the United States, and soon will be in Canada and Europe. For those therapies which target amyloid pathology, a physician has to determine whether a patient has amyloid in their brain before they can be eligible for that therapy. Because if they don't have amyloid in their brain, we don't think that patient's going to respond. So biomarkers of Alzheimer's disease can tell a clinician information that is very, very hard, or in some cases impossible, to get just from the medical history and the signs and symptoms, and can tell them about the biology of the disease. And that's going to give them really important information about how the disease is going to progress and what therapies they're going to respond to. Now we'll talk a little bit about different Alzheimer's disease biomarkers. So broadly speaking, Alzheimer's disease biomarkers are generally classified into two broad categories. The first is imaging biomarkers, which includes positron emission tomography for either amyloid or tau, which are the core pathological features of Alzheimer's disease, and magnetic resonance imaging, or MRI. That's the imaging kinds of Alzheimer's disease biomarkers. The second category of Alzheimer's disease biomarkers are biofluids, which consist of either cerebrospinal fluid, which is measured from a lumbar puncture, or blood plasma assessments of Alzheimer's disease pathologies. Imaging biomarkers have a really important advantage because they can tell you about the topographical distribution of different pathologies in the brain. And this is really helpful for subtyping and for staging the severity of Alzheimer's disease. In contrast, fluid biomarkers are really helpful because they can tell you information about multiple different abnormal proteins from the same sample, which you can't do with imaging. So for PET biomarkers, the two most commonly used ones are amyloid PET and tau PET. Amyloid PET, which you can see here in the figure, their scans are often dichotomized as being either amyloid negative or amyloid positive. Amyloid positivity is required for a diagnosis of Alzheimer's disease. Tau PET is a little bit different. Tau PET can sometimes be categorized as normal or abnormal, but people also use it to stage Alzheimer's disease because the topography of tau PET binding is very closely associated with the kinds of symptoms a patient has and with how severe the symptoms are. To talk a little bit about CSF biomarkers, from a lumbar puncture, cerebrospinal fluid can be analyzed for multiple different proteins that have leaked from the brain into the cerebrospinal fluid. While there are many biomarkers that exist in CSF, this article will focus on the most widely used ones in Alzheimer's disease, which are the amyloid-β 42/40 ratio, p-tau, and total tau. The amyloid-β 42/40 ratio is low in patients with Alzheimer's disease, which at first was a little bit confusing, but researchers determined that people with low CSF amyloid are the same people who have high amyloid PET. And the reason the CSF amyloid is low is because the amyloid is staying in the brain, it's clumping up there, and it's not being cleared by the CSF. Another protein that we use to diagnose Alzheimer's disease in CSF is p-tau 181, which means phosphorylated tau. And phosphorylated tau is what eventually aggregates into neurofibrillary tangles. So those are two core pathologies of Alzheimer's disease that are used to diagnose it in living people. Finally, a lot of these same biomarkers are now being detectable in blood plasma. And we think that this is going to help circumvent the amount of people who need a lumbar puncture because there will be a very accessible assessment of blood biomarkers for Alzheimer's disease. And for further information, see the article Biomarkers for the in vivo diagnosis of Alzheimer's disease on the Neurotorium website.